Hey guys, this is Dr. Cosby again. Just wanting to do a brief mini lecture as you guys have gotten through both the appraisal skills and the different appraisal checklists. And obviously, the list is cumbersome, and the list included in this particular course doesn't even include some of the other appraisal skills and checklists that are out there. I've kind of just given you the ones that you would usually use in the allied healthcare profession. With that being said, I just wanted to make sure that I was clear on what the difference is between an appraisal scale and an appraisal checklist. And so when we think about the two of them, both appraisal scales and appraisal checklists, they're instruments that can be used by researchers and clinicians, right? And reviewers, maybe if you're submitting a manuscript. And the goal or the job of each of these two things is really to allow us to examine the research quality or to guide, in your case, right, the construction of a viable research study, right? So this idea that it would guide you through this process to make sure that when you're creating your research study or you're writing your manuscript, that you truly are writing it as if it were going to be appraised by a reviewer should you submit that research article to an actual journal. So let's talk about the differences really quickly. Scales, appraisal scales, produce numeric scores, right? And so we've seen that with both the Pedro scale and the Jodad scale as well, that it will give the research article a number or a score, and that's going to be, that number or score is going to be based on the incorporation of a specific set of criteria, right? And that criteria, again, is going to vary from scale to scale, so be careful with that. So we basically would use scales to appraise the quality of the evidence. And so in the last module, we talked about the hierarchy of evidence, where research articles fall within the actual paradigm of research, right? And part of the reason that that hierarchy exists is because the majority of those research articles probably were appraised, and their score kind of helped dictate where they fell on the hierarchy or the levels of evidence pyramid. On the opposite end of the spectrum, what we have is the appraisal checklist. And just as the name implies, it's going to serve more as a guide, right? A checklist system to check off as you're getting ready to either submit that manuscript or as you're writing your research and getting ready to conduct your research. So it's going to serve more as a guide when you're establishing study parameters, but it's also used as a guideline for authors, right, to enhance the quality of their manuscript. And I'll give you an example. I just submitted a manuscript to the Journal of Manual and Manipulative Therapy. And so for my particular research article, which was a randomized control trial, what I used is the consort checklist. And so in doing that process, I realized that I was really missing two key components. One of those key components is a power analysis, and they actually wanted that in the manuscript. Had I not put that in there, my manuscript may have been rejected right away. So again, an appraisal checklist is just that. It's a guideline for authors to enhance the quality of the study and hopefully increase your chances of at least getting through to the peer review process in journal submission. So both a scale or a checklist can be used to establish your study procedures. And then more importantly, when we think about this process of critical appraisal as we move forward in this module, it's absolutely essential, right? We would say that, you should appraise all of the research articles that you're using in your lit review for Kinesis 605 for your project in this particular class, or as you move forward and as you become either a researcher or you become a clinician who's trying to make decisions as it relates to your clinical practice. However, I will say that the score given to an article must be interpreted with some caution, right? Because at the end of the day, these authors chose to report these specific flaws within the study, and it's these specific flaws maybe that might drive other research. So as you're going through this process of critical appraisal and you're looking at maybe research articles that really get low scores, it may be due to poor study design, but at the end of the day, these poor study designs really drive the majority of research that's going on now, and maybe some of the research that's going on in our master's program as we speak. So I just wanted to kind of talk about the differences between an appraisal scale and an appraisal checklist. In my mind, an appraisal checklist is really going to be helpful as you're going through this process of either completing a master's thesis or a capstone project, because it will allow you, as you're writing that manuscript to get published, to ensure that you have everything that you might need that a journal might be looking for in terms of the quality or the rigor of your particular manuscript and your research. And then an appraisal scale, again, is hugely important in terms of assessing the quality of the research article. But remember, low scores don't always mean that that's a bad thing. What it means is that maybe there's more research that needs to be done, or more highly developed research studies in this particular area that increase, right, the appraisal scale scores in this research paradigm. So thank you for your time. I just wanted to give you a quick what the difference was. As always, if you have questions, I'm in my office Tuesday, Thursdays between 7 to 11, but I'm also available via email anytime. Thank you for your time.